Hello everyone, this is Dr. Pratpal Singh Matreja, an MBBS MD Pharmacology from CMC Ludhiana. And although it has been a very long period since I had my last series of small presentation on selection criteria, today I would go with a small presentation on outcome measures because whenever we are talking about the methodology section of the study, we tend to have many factors in the methodology section. In few of my videos, I've already talked about the study population, the inclusion exclusion criteria, and today I want to discuss the various outcome measures, how they are defined, what are the various outcome measures that we look for in the research, and maybe after this lecture, it could help you a bit to go ahead with the parameters that you would like to assess in your research study. So, without any further ado, I would start with this particular presentation on the outcome measurements, and we'll talk about these outcome measurements, what they are, and what exactly they mean, and how we should proceed ahead with this. So when we are talking about these outcome measurements, what do they exactly mean? Now, for an outcome measurement, what do we want? We want to improve the patient's safety, as well as we also want to evaluate the effectiveness of a solution in real life setting in terms of their impact, acceptability, and affordability. So we would be talking about certain evaluation methods where we can evaluate the effectiveness in the real life setting. We are talking about a clinical research methodology section, and how do we go ahead with the safety, and I would also be talking about the efficacy and the difference between the efficacy as well as effectiveness in a particular clinical setting. And because these terms often tend to be used as a synonyms, but they are not synonyms, they mean a totally different term. So we start with the definition. Now, as per definition, what is an outcome? Now, an outcome could vary depending upon which perspective we would like to take into account. So in general, when we talk about an outcome, it is a measurable individual, family, or community state, behavior, or perception that is measured along a continuum and is responsive to clinical intervention. So what are we talking about out here? We are talking about giving a clinical intervention, its effect on an individual basis, on the family, and on a community as a larger perspective. Now, what is an outcome measure? Outcome measure, this is basically an outcome that we are trying to look into the response, and how do we measure it? That is what we call as an outcome measure, or the parameters that you want to assess. So these are a set of items that are used to create scores that are intended to quantify a patient's performance or health status based on standardized evaluation protocols or close-ended questions. Not open-ended questions, we are talking about close-ended questions because we want to quantify the patient's performance. And when we use an open-ended questions, there would be a lot of leading aspects that might not be easy. You might not be able to interpret them, or if you want to interpret an open-ended question, it would be best ideal would be that we go for a qualitative study. So why do we want to measure patients characteristic using standardized outcome instruments that we are trying to use out here? Because we want a documentation, we want to use it in clinical information system, we want to use it for the development of clinical knowledge and professional education, and we want resource allocation and accountability. Moving further beyond this, it is a cycle. And what is this cycle intended to do? This cycle says that we have measuring the harm, we are trying to understand the causes of that particular harm, we go for identifying the solutions. Once we give the solutions, we evaluate the impact, and once the impact is evaluated, we translate into this evidence into safer care. So we are looking for an evidence-based medicine where evaluating impact would have a direct consequence of translating evidence into a safer care. And that is what evidence-based medicine talks about. And we'll even be talking in this session on these outcome measurements. What is the level of evidence for a randomized controlled clinical trial, for a case control study, for a cohort study, and so on. So out here, what we are trying to do is we have a solution, we give that solution, and we evaluate the impact of that solution. And if effective, we can translate this into evidence into a safer care. That is what we are doing. Now, there are these 6 Ds are used for outcome research, and these Ds are death, disease, disability, discomfort, dissatisfaction, and dollars. So death is the ultimate, whether it was associated with mortality or not. Disease, did it lead to a significant impact on the quality of life, or did it worsen the disease further worsen? Was there a significant disability that the person was not able to perform his day-to-day course, or was the disability to such an extent that he had limited capabilities, or he was totally incapable of performing a particular task? How much discomfort did it cause? Was it satisfactory? And dollar signifies the cost that is involved for a particular treatment. For any treatment to be effective, the cost has always to be kept in mind. A lower cost always tends to have a greater impact as compared to a higher cost. Now, as per the Agency for Healthcare Research and Quality, that is AHRQ, outcome research is about what works, what doesn't, when in the course of illness does it work or it does not work, and at what cost. So we are talking about all the 6 Ds that we mentioned in the previous slide out here. What is working, what is not working, whether effective or not, whether and at what stage of the disease can we use this intervention, and what is the cost involved in using this intervention. Now, as such, when we talk about the outcomes, you do not have any uniform definitions. And outcome research is basically a scientific study of the results of diverse therapies that could be used for a particular disease, a particular condition, or illness. And this outcome is linked to evidence-based medicine. So we are invariably going towards an evidence-based medicine where we want to have a cost-effective therapy based upon our outcomes that are there, our interpretation of results that could be possible with them. Now, there are certain measures that are uniformly used by people, and what we tend to do out here is maybe in these presentations or coming presentations, what I tend to do is I tend to want to make a uniform criteria for what are the various measures that could be used irrespective of the disease. Now, as per the conventional clinical measures that are used, we can use mortality, we can use the disease or treatment complications, whether the particular therapy prevented the complication or whether there was any complication associated with the therapy. How did it alter the pathology of the disease? Was there any physiological or lab abnormality associated with it? Any deformity associated with it? And what happened to the signs and symptoms? Were the signs and symptoms or the major concern or the major worry for the patient taken care of, or they were not taken care of? So all these things do come under conventional clinical measures. Now, what I'll go ahead with this is a simple diagram that shows that what are the various assessments that we would like to go ahead with, and this would be one of the key factors that would help us decide how we want to go ahead with it. So based upon the outcome that we would like to go ahead with, the patient outcome assessment could be categorized into 4 things or 4 different perspectives. The first perspective would be the perspective of the clinician. How or what significant impact does the clinician feel that this particular treatment has had on the patient? The second could be the one reported by the patient, because ultimately it is the patient who is having the disease, and if we don't take patient into consideration on the outcome, it would be a big uh, drawback in our part. And then whenever we talk about patients, uh, there is a social bonding around the patients, and this social bonding is involved with the various people that are associated with these patients, or invariably often called as caregivers associated with this caregiver could be the mother, father, it could be the spouse, it could be the sibling. So what has been the impact of the treatment on these caregivers? And obviously we also need to look into some parameters of our body functioning, how normal these parameters are. So based upon these, our outcomes could be divided into four parameters, and these four parameters are clinician reported, the physiological components, the caregiver reported, and the patient reported. For a clinician reported uh, assessment, we can have an example of observations and tests of various functions that are there. For physiological functions, you could go for various laboratory tests such as glycosylated hemoglobin, or maybe any other parameter, that how this parameter has come back to its normal value. We could go for a caregiver reported, what is the functional status of the patient, how much he is dependent the on this particular uh, patient is how much dependent on the caregiver, because it does add to the stress of the caregiver also. A patient in a or a disease condition not only affects the patient, it also affects the entire social circle that he is impacting. And we also do study it, that this social factor does tend to play a role in and we cannot neglect this part of social responsibilities or social impact of a particular outcome or a particular treatment, and that is what we want to highlight out here. And for the caregiver reported uh, outcomes, we could use for the dependency, or we have these various questionnaires, or the functional status of this particular caregiver. Is he hampered, he is not able to perform his daily activities, and so on. And the major part of outcome obviously is the person who is suffering from it, so it is the patient. And it could be patient reported, such as the global impression of the patient, what is the functional status of the patient, the well-being of the patient, the symptoms, any relief with the symptoms, the health related quality of life of this particular patient, satisfaction with treatment, adherence to the treatment, utility or preference based measures. So depending upon what our disease question is, as we were talking about in our previous few presentations, we talked about the hourglass performance, where we start with a broad perspective. Our methodology section tends to go constrict to a particular area. Our results are focused on one particular area, and then our discussion widens up. That is the hourglass approach. And then we've also talked about the PCOT format, where we were talking about the patient, the intervention, the comparator, the outcome, and maybe the time. So based upon what our PCOT is, what our research question is, our outcome measures could be divided into either the clinician reported outcome, or the physiological, or the caregiver reported, or the patient reported. And all of them are somehow important, and we need to focus on them. So I'll halt my presentation for the day, and I would just focus on these four aspects. And maybe in a few coming days, I would try to go ahead with what are the patient reported, and what are the levels of evidence of the clinical trials, and what are the various statistical mistakes that we tend to do. All these things come under outcome measurements, and we would try to answer all of them one by one. And I'll call it for the day today, because this is what I wanted to focus on, that whenever we are talking about the outcome assessment, we can focus on four aspects, four broad perspectives of outcome assessment. These broad perspectives could be the clinician reported, the physiological, the caregiver reported, and the patient reported. And according to your study design, according to your study population, according to your selection criteria, you could choose any one of them. What are the advantages, what are the disadvantages, and maybe other things. We can come up with all these solutions in the coming uh, resource presentations in the next few couple of days. And I believe today I would just highlight these particular aspects, and I would end my presentation out here with the four outcome, patient's outcome: the clinician reported, the physiological, the caregiver reported, and the patient reported. Depending upon your study, you could select any one of them. And maybe I believe I could have maybe ignited few questions, or maybe I could have maybe raised a few queries, or maybe I could have solved a few queries. So there's anything related to this presentation, I would be very happy to answer your queries. Uh, you could just uh, give it in my chat box, and I'll definitely get back to you, and hope you have a good day ahead. Thank you so much for your patient listening.